So I'm away on holidays and I figured this is a great time to discuss a really important topic. Guys, I know some of you have had girth enhancement procedures from other providers, some local, some abroad, some by plastic surgeons or world-renowned aesthetic physicians, but you're left with an unaesthetically pleasing outcome. It's misshapen, it's deformed, it just doesn't look good. So you do some research, you find out all about me, you go to my website, you see my before and after photos, and then you contact my office so that I can help you. I'm Dr. John Leonardo. I'm a board-certified anesthesiologist, a chronic pain specialist, and an aesthetic, regenerative, and sexual medicine physician. Before seeing me in consultation, we'll ask that you provide images for my review submitted privately. And 95% of the time, my recommendation is going to be to have your filler dissolve prior to my treatment. The short answer is really simple. It's far more difficult to create something beautiful out of something that is aesthetically unpleasing as opposed to starting with a clean slate where I can really work my magic. The long answer really requires a discussion of why do we have poor outcomes. There are 4 reasons. The first reason, shrinkage. If there is a large disparity between flaccid and erect length, you're going to have problems. You're going to have contour irregularities unless that is addressed. Problems 2 and 3 go hand in hand, and that is product placement and product selection. So if your provider is injecting rather superficially and using a firm gel product in hopes for it not to migrate, that's at the expense of having product visibility and perhaps sometimes a lumpy appearance. If your provider chooses to inject superficially with a softer gel, which tends to be very hydrophilic, it's going to have a spongy quality to it, and sometimes it appears like a water blister. Fourth reason is just the way that your provider is sculpting. Sometimes they may only augment the top surface or the dorsum and neglect the sides, or vice versa, where they only augment the sides and nothing on the top. These 4 issues can lead to a really poor outcome. Compare this to my protocol. Before procedure, the patient is assessed for shrinkage. If there's an issue, then we're going to pre-treat them with Grotox. It's botulinum toxin for growers. And this allows the penis to hang longer in the flaccid state so that there's not that much variation or size discrepancy between flaccid and erect. In terms of product selection and placement, I like to use a blend of calcium hydroxyl apatite with HA. It's soft and it's fluid. However, I like to inject deep such that it's below a superficial layer of connective tissue and above a deeper layer of connective tissue. So it's kind of sandwiched there and trapped, kind of like filling a balloon. When we fill, we're augmenting uniformly throughout. The calcium hydroxyl apatite will stimulate collagens types 1, 3, and elastin synthesis. And the HA that it's blended with will draw water and hold the bulky shape. But again, it's trapped between these 2 connective tissue layers, so it's going to be nice and smooth, and it has a dense texture to it. In terms of injection pattern, I like to inject circumferentially so that we maintain a natural appearance. Remember, it's supposed to be you, only bigger. What better way than to address every angle? Now imagine me trying to perform my procedure and there's all this superficial filler. It obscures the view of my cannula, the feel. So I really don't know where I'm injecting. It's a lot more blind. Secondly, if I'm injecting deep and really trying to inflate that balloon, that sandwich, and there's superficial filler on top of it, we're not going to correct the contour regularity because there's product on top of that balloon. I have a high patient satisfaction rate. Sometimes there might be minor contour irregularities that we can do a focused light dissolve, or sometimes we can build around it on the next session. I realize no one wants to dissolve their filler, particularly if they've spent a lot of money on it, but do yourself a favor and have it dissolved. You're going to be so much happier in the long run.